Rachel Ellingson was living her best life when she was diagnosed with stage 4 colorectal cancer. She passed away in 2019, but her legacy lives on through the Live Like Rach Foundation. Pat Monson and Dr. Kimberly Colehorst have information on how others can spot the signs.
Good morning, and thank you for joining us. Today we're going to be talking about the Live Like Rach Foundation and early onset colorectal cancer. Joining us today is an expert in the field, that is Dr. Kim Colehorst, a gastroenterologist, to talk about early onset colorectal cancer. So, Dr. Colehorst, what is early onset colorectal cancer?
Early onset colorectal cancer is the diagnosis of colorectal cancer in any patients between the ages of 25 to 49, so patients under the age of 50.
What are the symptoms of colorectal cancer? And by that I mean those in the age group from of any age group, not just early onset, correct?
Absolutely, correct. So the two most common symptoms are typically constipation and blood in the stools. But patients can also have change in bowel habits with new diarrhea, new constipation, change in stool caliber. Sometimes those stools can become more pencil thin. You could also have bloating, nausea, gas pains, abdominal pain, unintentional weight loss, and a new diagnosis of anemia.
These symptoms don't occur altogether, or don't have to.
That's correct.
And so they can indicate other conditions. So are those symptoms misdiagnosed?
Yes,
typically?
absolutely. Unfortunately, what happens is most of the patients with early onset colorectal cancer will see more than one physician, about 67% of them, before they even get the diagnosis of colorectal cancer. And it does become misdiagnosed because at that age, the patients aren't thinking about colon cancer, and sometimes even the providers aren't. And so they'll often misdiagnose with irritable bowel syndrome or even hemorrhoids, and then that ends up putting things off, and then they end up getting diagnosed with the colon cancer at a later stage.
And how does that affect survivability, particularly the 5-year survivability rate of colorectal cancer?
Yes, so at stage 2 diagnosis, you have a 72% 5-year survivability. At stage 4, then that survivability drops down to 13%, so it's very significant.
When, as a gastroenterologist, when do you recommend that these individuals with symptoms be screened?
So right now, the USPS task force has actually decreased the screening age to 45. It used to be 50 and now it's 45, which is a really good move in the right direction. So that way, hopefully, we'll find more of these cancers or these polyps a lot sooner before they've had a chance to grow or metastasize.
And what type of screening is available for individuals who have these symptoms?
So colonoscopy is what I say is the gold standard because not only is it a diagnostic test where you can find cancers, but it's also preventative, meaning that if we find any polyps, which are the precancerous growths, we can remove those at the same time to help prevent colon cancer. Outside of a colonoscopy, there is also a Cologuard test, which you've probably seen the commercial for, with the box that you can send in the stool. There's also something called the CT colonography and then a capsule colonoscopy, which not all institutions have that available.
So for anyone who has any questions about early onset colorectal cancer or colorectal cancer generally, please, during the month of March or any other time, go to livelikerach.org or give our good Dr. Kim Colehorst a call. We want to increase the survivability rates of those individuals with colorectal cancer. Thank you.
Thank you.